Welcome to the 2022 RUSH Lupus Clinic and LSI educational event. We have a really great program. We're going to get started in just a second, but first I just wanted to make some announcements.
This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. This event is being recorded and will be archived on the Lupus Society of Illinois' website. Just like in past years, we have a really amazing program. We have 3 different presentations, and then we have a panel discussion at the end. So it should be a really wonderful day. Our next educational event will be February 12th, Empowering Lupus Patients educational event. Knock on wood, it will be live. It'll be our first live event, educational event since COVID started. And I want to thank our sponsors, GlaxoSmithKline, who will be saying a few words at the first break, and also Aurinia Pharmaceuticals for their support. They really help us provide you with excellent educational opportunities. So we're really grateful for them. I wanted to introduce Dr. Jolly, who sort of was the mastermind of this whole educational event that is has really grown over the years. How are you?
Hi, very good. Thank you.
Sure. Yeah, thank you for making this happen again this year. I know you and Dr. Nika at the RUSH Lupus Clinic are really busy, especially this time of year, and we really appreciate you taking the time.
Thank you so much. It's always a pleasure to host this event. We've been doing some educational events, but we formally started calling it the annual educational event, but we've been doing, Mary, with you for now over 10 years, varied educational events at RUSH and outside of RUSH, and we are very proud of the partnership. We take our responsibility very seriously of participating in the community, educating our patients and their caregivers, and support them in whatever way we can. So I welcome everyone today here for making time to join in with us, and I want to thank Lupus Society of Illinois, as well as the sponsors that are supporting this event today. So thank you for your support. The responsibility is all of ours, and we all are doing our share. I'm very excited about today's program. I'm sorry it is virtual, but keeping everyone safe is more important than having a face-to-face interaction. But hopefully, as Mary said, next year, maybe things will be better and we'll meet in person back again. I wanted to take this opportunity to introduce LaShawn to you. LaShawn Gorola is a dear friend, and I cannot even imagine how we would function in our clinic in the hospital without her and her support. The biggest thing I tell you, she is a bunch of energy, bunch of positive energy, and she brings her, energy is very infectious, and she's a great supporter of the doctors, the patients, their family members, and in the community. It is an immense pleasure to know her. Actually, I thank God that our paths crossed at some point of time. So LaShawn is trained as a nurse. She, as I already told you, does community service and social work. She is the leader for our support group here at RUSH called Learn at RUSH. She is a volunteer. She has several other venues where she supports lupus educational activities. But most importantly, she's a patient and a patient advocate. And that's what I really admire in her. And as I mentioned, she's a patient. And it is quite admirable that she is pursuing further studies while handling all that. So hats off to her. And you know how hard that is, being a lupus patient. So she sets an example for us. She's a major support for our patients, our clinic, our hospitalized patient support group. And I welcome LaShawn that she's sharing this day with us. Thank you, LaShawn.
Thank you, Dr. Jolly. It's a pleasure to be here. I have to say that you didn't miss anything. I am quite full of energy and busy. Today was actually my support group day, and I did discuss with my group whether we should, forego our meeting to join this effort right here. And so we all decided collectively that this was the most appropriate thing to do. And that's one thing I like about my support group, is that I can also draw on them for support, and we kind of make decisions about the way the flow of the group goes collectively. So it's not just like a one-person operation. And you probably forgot, Dr. Jolly, our paths crossed in 2017. I started RUSH in 2016 as a RN care manager, and I attended an event similar to this in the fall of 2017. And at that meeting, Dr. Sequeira was doing the event. I think he did the morning group and you did the afternoon group. At that presentation, I met Paula Brown, and I asked her, I said, I'm really interested in getting a lupus support group going here at RUSH. Who would support that endeavor? Who should I reach out to? And she gave me your name, and I emailed you that same day, I think right after your afternoon presentation, which I wasn't able to see yours. And so I think we've been connected ever since I sent that email. A lot of people ask me, why do you do this? And I have a better question, is why not do it? And at the time that I felt so passionate to get a group started at RUSH was because I was seeking support for myself. As you mentioned, I am also a lupus patient, and I think a lot of times people forget. They look at me and say, oh, well, she looks pretty good. But yes, I have lupus, and it takes really a great effort to look like I don't sometimes. I struggled last night, and I'm happy that I can be here because I had the support of someone special. And I have to say, a lot of people ask, are support groups necessary and do they bring value? And I have to say, just the growth of over the last year with LSI support group. I believe we have 3 new locations, Elmhurst, Greenup, and Rockford. Just the idea that it's needed and people are recognizing that. And I know I have to wrap this up soon, so I would just say that it is important to connect people with lupus, not only the patient, but the families, the friends, the significant others, the loved ones, so they can learn and understand how to support the person with lupus. It's always not as simple or as complex as one might think. So with that, just knowing that validation and that connection to someone that understands and gets it. And then at the Lupus Learn support group, we have that educational component that we're able to teach others how to support their loved one with lupus. And with that, I'll turn it over to you, Dr. Jolly, to continue introductions. Thank you.
Thank you so much, LaShawn. That is wonderful. And now I would like to start our educational activities. And there has been a change for good in our RUSH Lupus Clinic team. We have the newest member that has joined us in the RUSH Lupus Clinic, and that is Dr. Dmitri Cherney. Dr. Sequeira has retired and is enjoying his life now. And Dr. Cherney has taken his place and brought in young energy and enthusiasm with him. Dr. Cherney did his residency at RUSH as well as his fellowship in rheumatology at RUSH. And he is, his major interests are lupus and myositis, but he does general rheumatology. He's an educator and a great clinician. So I welcome Dr. Cherney to do the presentation for us today. Thank you.
Hi, everyone. Thank you so much for the introduction, Dr. Jolly, and I'm hoping everyone can see my screen and hear me. And thank you to Lupus IL as well for having me. It's really an honor to be here. And some of you I might have seen even in clinic with Dr. Jolly as I did my fellowship and training in rheumatology at RUSH as well. Some of you I see in clinic now, and I'm sure that I'll be seeing some of you, I'm sure, around as I have a Tuesday morning lupus clinic as well. So I wanted to get right into our first topic, and it is a hot button topic, and certainly something that is really important for lupus patients. So I'm just going to full screen here, and hopefully you all can see this. So I will be talking about vaccinations and lupus. And so the overview, first I'll say I have no relevant disclosures. The overview of what we'll be talking about today, we will start, unfortunately, with some Saturday morning science. So I think we need a little background to understand things like what is immunity, and what is a vaccine, and how does it work, and why do you need one? And then we can move into which vaccines you need, which ones are safe to take, and how are they taken. And then I wanted to ask some frequently asked questions and kind of raise important points that I hear about a lot from lupus patients. And then, of course, we'll leave some time for questions from you all. So jumping into the science of things. So when we talk about bad things that can infect us, we call them pathogens. And the more kind of layman's term for that that you all are familiar with is a germ. So what is that? What is a germ? It's a very small microscopic organism that's capable of causing infection in people. So the ones that are probably more famous would be bacteria, and examples of that would be like strep, or if you've had a staph infection, or tuberculosis, among many others. Viruses are very famous, and they're of course in the news because COVID is a virus. Flu is another famous one. There's also other ones. There's fungi, like the ones that cause athlete's foot. There's protozoa, which can cause things like malaria. There's parasitic infections, like some of intestinal worms that we don't see very much in our industrialized world. And these are usually bad, but there's actually also a portion, I'm sure you've all heard of, like good bacteria in your gut that kind of promote digestive health, among other things. But there are these classes basically of germs, and we're mostly going to be focusing on bacteria and viruses when we're talking about vaccines. So how does our immune system recognize them? So first, when we are in the world, we have basically quite a lot of exposure to different small microscopic creatures around us, and they basically interact with us through every route that they can get in. So one would be through your skin. If you have a cut or a scrape or any sort of a wound, they can get in through your gut, through just basically through your digestive tract. They can get in through your lungs, which is of course a famous route because again, COVID, flu, and pneumonias and things like that. You can have urinary tract infections, bladder infections. So wherever it is that we encounter these germs, our body tries to protect us from them. And how does it do that? So what is the main thing that our immune system does? It actually sends white blood cells to wherever it is that they encounter the germ. So white blood cells are kind of the main actors in our immune system. So white blood cells, there's a couple kinds. We're not going to get too much into science here. I think it can get overcomplicated for no good reason, but I'll just talk about two different responses. The sort of older and primitive part of our immune system that I like to kind of compare to like basically frontline soldiers, like grunts. They aren't necessarily they're not thought to be really smart. They're strong, and their job is to kill infection. So how do they do this? They get to a site of infection, our body sends them in, and then they basically surround the bad thing, and then they release toxins that kill germs and cause inflammation. They're also, in large part, the things that contribute to why we feel sick when we feel sick. So fevers come from, from a simplistic explanation from them, body aches, that general feeling unwell, that's all often from that kind of response. And then there's a newer, relatively newer and smarter part of our immune system. And I'll basically call them lymphocytes for simplicity's sake. This is part of the immune system that allows us to essentially remember infections and to fight infections intelligently. So these are kind of like the special ops. They're smarter and stealthier. Their job is to, after the frontline ones go in, they swallow up the germ, they process it, then they show pieces of that germ to other smart immune cells, and then they make, this is going to be the big buzzword, antibodies. So antibodies, their job is to come in, and once they're made, they basically tag the bad guy coming through the door, and then as they come through, your immune system recognizes them and can kill the germs without ever really having an infection. So when you have these, you can't be infected by the thing it's trying to protect you against, which is a huge advantage. So what's immunity and how do I become immune? So having antibodies, as I mentioned, it protects you. That's sort of saying the same thing. If you have antibodies against germs, it makes you immune to that germ. And there's really two ways to get that. One way is to have an infection and get over it. And that's kind of the old way. And that's what humans have done and do now through all of history. And then there's the other way. The other way is to show your body the infection, not the infection, excuse me, to show your body the germ so that you get that antibody response and that those antibodies work for you, but without exposing yourself to the infection. So obviously the second way is a lot better because you don't have to get sick. So what's a vaccine and how do they work? So there's a lot of different kinds, and we'll briefly talk about the different kinds, and I don't mean to confuse anyone by talking in too much detail about them, but in simple terms, it's basically the bad thing, the germ, that has been killed, or it's been weakened, or it's been cut up, or different pieces of it are introduced into your body. So when you see these, like, I'm not sure if you see my mouse here, but in the middle part of the box here, you see these red things. Those are really what antibodies look like on a really small scale. So in the beginning, you get basically the bad thing coming in, and then you get an immune response that makes those antibodies, and then it protects you from it. So there's actually 4 different general ways to make vaccines, and I hinted at this. You can either inactivate the virus, let's say, if it's a virus. You can, and often they do that by killing it. So you can get dead virus. You can also have a weak virus introduced. You can also have parts of a virus introduced. So the COVID vaccines, like let's say the Pfizer and Moderna, those are, if you look on the bottom right, they're what's called DNA or RNA pieces, basically, that are put into your body and still have the same effect. So essentially, I wanted to play a video or two for you in case anyone here is a kind of a visual learner, and we will take a quick look at kind of a visual representation of saying the same thing. So let me just play this for you.
The immune system attacks germs and helps keep us healthy. Each germ has different markers on it called antigens. To fight a germ, the immune system custom makes an antibody, also called an immunoglobulin, that attaches onto the antigen. The antibody tells other parts of the immune system to destroy the germ. After they are created, antibodies usually stay in our bodies in case we ever have to fight the same germ again. Antibodies are also made when people get vaccines. Building up lots of antibodies keeps the body ready to fight off any germs it meets.
And then one more that is a little bit more detailed.
How do vaccines help your body prepare to fight off harmful diseases? First, let's start off by introducing a group of sickening germs called pathogens. Picture pathogens the same way as you would the villains in a comic book series. These villains include some viruses, bacteria, fungi, and protozoa. They are microorganisms with a diabolical plan they wish to achieve, to take up residence in your body. If they succeed, they could develop into a disease or illness. They achieve their goal by attacking, invading, and replicating inside your body, damaging our healthy cells. In this video, we'll focus our attention on viruses and bacteria, how your body's immune system defends against these invaders, and how we can help train our immune system to prepare it to prevent future infections. All right, first let's talk a little bit more about bacteria. Bacteria are unicellular organisms, meaning they have one cell and can be found surprisingly everywhere. Thankfully, not all bacteria cause disease. Some are actually really beneficial to your body, like those that live in your intestines and aid digestion. However, there are also dangerous ones that are responsible for diseases like strep throat, tuberculosis, food poisoning, syphilis, and so on. Viruses are smaller than both human cells and bacteria, but where they lack in size, they make up in overall mightiness. Undoubtedly sneaky, viruses come in various forms and pack a punch once inside your body. They reproduce by taking control of living cells in your body and using your cell's machinery to produce thousands of identical copies at a mind-blowing rate. Viruses are responsible for causing infectious disease like the common cold, flu, measles, Ebola, Zika, and so on. Sometimes prevention is much better than treatment. If you prevent a disease, you don't get sick in the first place. And if you're not sick, you can't spread the disease to others. How can we do this? By boosting the power of our immune system. The immune system is complicated, however, greatly appreciated. It consists of various components that communicate and interact with one another to complete a critical task, keeping us healthy and alive by protecting our bodies from dangerous pathogens. The immune system has three main functions. First, it detects unrecognizable or abnormal material like those pathogens, viruses, bacteria, etc. Second, it attempts to kill or destroy the pathogens. And third, it keeps a memory of the pathogen in case it tries to invade again. Our white blood cells, aka lymphocytes, are the heroic warriors that terminate deadly pathogens. Using their power, they battle the pathogens and produce antibodies that help them identify and eliminate foreign material. But sometimes it can take a long time for our immune system to finally clear our bodies of foreign invaders. Fortunately, we are able to shorten this time using vaccines that act as an immune system accelerator. Vaccines primarily consist of a weakened, killed, or fragmented piece of a pathogen, not whole live pathogens capable of causing illness. Once inside your body, the vaccine triggers an immune response, training your body to recognize and fight off the specific pathogen. If your body were to encounter this pathogen again, your immune system will be prepared to attack and destroy it more quickly, preventing you from getting sick and, importantly, from passing the illness on to others.
So for those of you who like videos and who like pictures, I was saying a lot of the same things, but I think it is more helpful to see it in that kind of format. So, I mean, the obvious question and the first question is, why should I really care about this if I'm a lupus patient taking immunosuppression? Effectively, we know, and many of you are already familiar with the idea that if you have an overactive immune system that's targeting your body, then you have to take these medicines that lower your immune system to control the disease. And then as you do that, the side effect of that is that it increases your risk of infection, and of course of a very bad infection with things that infect other people already. So while there are many vaccines like the flu and the tetanus shot and COVID that really they recommend to everyone, not just people with immunosuppression, they become especially important if you have lupus and especially important if you take immunosuppression. Okay, so that's really the whole reason why you in particular might need a vaccine more than the average person. So let's see if I can, okay. So let's talk about the kind of vaccines that are safe for you to take in lupus, and actually the ones that are recommended in lupus. So first, I'll broadly say the ones that are dead or are pieces of a vaccine, those are the ones that are safe to take, which means there's only the ones that are live that are a little bit more of an issue, and we'll touch on them in a second. But the ones I'll be talking about, these are all suggested in lupus, and they're all safe to take in lupus, and they're all very important in lupus for the right person. So we'll talk about each of these. We'll talk about flu shot, we'll talk about the tetanus shot, we'll talk about shingles, we'll talk about pneumonia, and then of course we'll spend some time, a little more time talking about COVID. So flu shots, always a hot button topic. A lot of patients will tell me that, you know, it makes them feel bad and that's why they don't want it. So let's actually talk in a little detail about what it is and who it's recommended for. So this is recommended actually to every person, not just lupus patients, not just immunosuppressed patients, every year. In the fall months, into the spring months. There's several forms that I'm not going to get into too much detail again. Remember that there's different ways to make a vaccine. So the most common ones, the flu shot, are killed or chopped up flu virus, which means they're perfectly safe to take if you have lupus, if you take immunosuppression, and in fact recommended. There's only one you should be aware of that you should not receive if you're taking any form of immunosuppression above Plaquenil. So that would be things like Cellcept, azathioprine, lots of prednisone, Benlysta, cyclophosphamide, and many other medicines used in lupus. So that is the intranasal vaccine. So that's the one that's shown in the picture here. That is weakened live flu. You don't take that if you take strong immunosuppressants, but the shots are absolutely recommended. They make the shots by essentially looking at what strains of flu, what types of flu are happening in the world, and they protect you against 4 common types for that year. So why is it repeated so frequently? It's because what happens is it infects a lot of people and then it mutates, similar to, you know, you've heard about COVID mutation possibly. So it mutates a lot and then it needs an updated shot to protect you against the new strains. This is the most common thing that you'll hear about with flu, and that often many of you will tell me about with flu, and something that plenty of people do seem to experience to some extent. Fatigue, chills, muscle aches after getting the flu shot. So I want to correct one misconception. That is not the same thing as having the flu. You do not have the infection if you get the killed version of the vaccine, and it is not supposed to cause that infection. It is supposed to protect you against it. What you're experiencing most often is an immune response. Just like people get side effects with the COVID vaccine, it's the same thing with the flu shot. So often, if you feel a little groggy, not quite yourself for a day or two after getting the flu shot, it's not because you got the flu. The other thing is that some people actually do get the flu, so it's not 100% effective. And so if some people do get the flu around it, they think that it was the shot that caused it, when in reality, it just happened right around the same time. There's a couple other things you should be aware of. If you're over 65, you should be getting the high dose vaccine. And so if your doctor doesn't suggest that, or you're not sure what kind they're suggesting to you, but you're over 65, you're actually supposed to request the high dose vaccine. If they don't have it, a regular one is okay. This is preferred. Another important point, and this is actually true. I mean, people have been wearing masks for the last year or two now. And there's less flu around. There's quite a bit less flu, like sort of record low numbers, because people are wearing masks, and it's preventing a lot of cold viruses, it's preventing a lot of COVID, and it's preventing a lot of flu. But as we get back to normal life, and certainly we've started to do that in a lot of ways, this is going to come back. Flu is going to be with us. That's a virtual certainty. So this shot remains really important. So in terms of, can anyone not get the flu shot? Is it unsafe to give in anyone? So it's approved for everyone over 6 months of age, which is all of you, and the vast majority of people that are living of any age. So there's no upper limit. You get it every year. There's a couple groups of people that probably shouldn't receive it or have to be monitored carefully. If you've had something called Guillain-Barré syndrome, which is an incredibly rare neurologic disorder, which can happen on its own, but has been very, very rarely tied to flu, that is probably someone I would not give the flu vaccine to again, because it is potentially devastating, but that represents almost nobody. That's very few people. If you've had a very severe allergy to the flu before, which means you kind of ended up in an ER, or they needed to give you special medications for it, and you got very, very sick from it, then that is probably a reason to avoid it. That the CDC is reporting happens once every 1.3 times per every million vaccine doses given. Effectively, you can say that's a 1 in a million thing. And then there's this hot button thing that I'm sure you've heard of in some regard, people with egg allergies not being able to receive the flu shot. So that's because the flu shot is made with egg components. So if you have an egg allergy, you might be allergic to a part of the flu vaccine. However, the last several years, after reviewing a whole lot of information, the CDC actually recommends if you have a regular egg allergy, that is not a reason at all not to get the flu shot. Is perfectly reasonable. It is safe to get. If you've had a severe egg allergy, like again, you ended up going into anaphylactic shock, you ended up in the ER with it, then you actually can still get the flu shot, but you should be monitored for 30 minutes at the place where you're going to receive it. So those are the only conditions where I would advise someone do not get the flu shot. Otherwise, I would say if you have some aches and pains and fatigue afterwards, that's perfectly expected, perfectly reasonable, and it's probably protecting you from what you would have if you have gotten the flu instead. The next one we'll talk about just briefly is the tetanus shot. So tetanus, diphtheria, and pertussis, and you might have not heard of many of these diseases because they're very, very rare now, and that is completely because of these vaccines. It's come close to eradicating these diseases in our society. This is something that's given in simple terms every 10 years to all people, lupus patients, immunosuppressed patients, people who are perfectly healthy. It's recommended every 10 years. The most common side effect of this one is a sore arm for a few days. Less people have any kind of reaction to it than, let's say, the flu shot or the COVID vaccines. The tetanus shot is sometimes repeated a little earlier than every 10 years if you happen to get a cut, a scrape, or a wound. And this is the idea of this is it boosts immunity at the time when you might have exposure to tetanus. The next shots we'll talk about are the pneumonia vaccines, and there are actually two of them. So essentially with the pneumonia vaccines, they protect against bacteria that cause pneumonia. They're not perfect at doing that, but they almost definitely help you get not severe pneumonia if you get a pneumonia. In general, every adult over 65 is recommended to receive both parts of this vaccine. This is actually recommended earlier. This is important for you all. If you're taking immunosuppression, you're supposed to get both of these vaccines before age 65. So how do you do it? Well, you take this, if you happen to take Prevnar first, and your doctor gives you that first, you can take the second one called Pneumovax at least 8 weeks later. If it happens to be a month or two, that's okay. It just has to be at least 8 weeks. If you happen to receive Pneumovax first and go in the opposite order, you actually need to wait a year before receiving the other one. And then there's even some schools have thought about saying that you should receive the Pneumovax, the second pneumonia vaccine, again in 5 years after that. So a little more for a total of 3 shots compared to what someone after 65 would get, which would be 2 shots. And so the takeaway is, and this is too much detail, the takeaway is there's 2 shots, there's maybe another one in 5 years. There's very few side effects again with this one. Very few people come back and tell me they got sick from it. It's strongly advised if you're taking immunosuppression. So how about shingles? This is a very common one that we get asked about. So shingles, of course, is a very painful, basically viral infection that affects a patch of skin, and it causes really, really severe burning kind of pain and this blistering that you see here. It can be in various parts of your body, and some of you may have even experienced it already. So essentially, there's vaccines that prevent this. So Shingrix is the name of the newest one, and it is a perfectly safe medicine for you to receive. There used to be one called Zostavax. That one was a live one, and so it was a little tougher for patients with immunosuppression to receive. It was also not as good. This one's very effective. It is recommended for all adults over 50 years old. If you've had a chickenpox or a shingles infection, so chickenpox, let's say in childhood, or shingles as an adult, you should strongly consider it regardless of what else is happening. If you're taking immunosuppression, like especially a lot of steroids, like a lot of prednisone, you should really consider it well before age 50. And that's a discussion that you can have with your rheumatologist. So how is this given? It's actually another 2-part vaccine. It's 2 shots, and they're given anywhere between 2 to 6 months apart. if you happen to have received the old one that wasn't as good, called Zostavax, you can actually still receive this one. So the other one that was less effective, if you wait 2 months after receiving that one, you're actually allowed to receive this series, so these 2 shots, but you must wait 2 months between. This is over 90% effective at preventing shingles, which is much better than the other one, which was probably closer to the 60%. So even if you do happen to still get shingles through this, you will almost definitely have a less bad case, much less pain, less blistering, and etc. This is the difficult part about the Shingrix vaccine. It's not available in our office, so mostly you need to go to commercial pharmacies, the CVS and Walgreens. We can often write you a prescription for it, but we don't have it in our rheumatology office to the best of my knowledge. So let's jump into the last one, a very important one, and of course, one that there's a lot of debate around. So the COVID-19 vaccine. So we're going to talk about different aspects of it, but I'm going to start with who should get it and what forms are kind of most commonly given. Many of you have already heard these names before. So it's very, very likely that you have heard of Pfizer and Moderna, and they say J&J here, that's Johnson & Johnson. And who are these actually approved for? So these are approved, all of these vaccines are approved if you're 18 and up, all of them. It doesn't matter if you have lupus, don't have lupus, everyone is approved for all of them. If you happen to be younger, let's say 5 to 18, the only one that is approved right now, I think as of November 23rd, when I checked this last, was Pfizer. So Moderna technically is not approved for that population. If you happen to have very small children, like a 4-year-old or under, that is a population that, to my knowledge, is still not advised to get the COVID vaccine. So how do you get it? And again, this is not super important that you remember these details. I just wanted to give you an overview. So Pfizer. So that's one of the common ones. And of course, you get your first shot, and then you get another shot in 3 weeks or 21 days. And there's also some advice that if you happen to be taking an immunosuppression, strong immunosuppression, as many of you are, you should consider a 3rd dose. That's not a booster, but a 3rd dose 28 days after you finish your first series. Moderna is very similar. You get a shot, except you get your 2nd shot in 4 weeks, not 3. And then it's the same deal. In 28 days after that, you can consider a 3rd dose, which might boost your immune response. Johnson & Johnson, it's much simpler than that. It's 1 shot, and then there's no extra shots. So what kind of side effects might you get from the COVID vaccine? So as I talked about with the flu shot, your immune system can get activated. That's actually a good thing. That means it's probably working. So the most common side effect, far and away, is basically arm pain. You have arm pain, sometimes some swelling in the arm, sometimes some redness even in the skin over the arm. You might even have lymph nodes that are enlarged, and then systemically, like so overall, you might feel muscle aches, you might feel chills, you might feel fevers, you might get nauseous. All of that is totally possible, but the key thing is here that it may last only a few days and then it goes away. And that's true of the vast, vast majority of people who get side effects. We also have no way of predicting who is going to get the side effects. I can tell you on a personal level, like I've gotten the two vaccines, and then I've gotten a booster, and I had no side effects really except arm pain with the first 2, and then the 3rd one, I basically felt achy and unwell for you know, like 10 hours the next morning, and then it was gone. And that's a very sort of traditional thing that can happen. You never really know which shot is going to do it for which person, or you might not have any side effects at all. Is there anyone who is not eligible to receive it? So I mentioned if you're under 4 years old, but what about other things? Remember, the flu shot has all these other little nuances to it. This one is very simple. It's severe allergy, like we talked about with flu shot. And what we didn't talk about is what does a severe allergy look like? So this is anaphylaxis. That's anaphylaxis saying shock from an allergy. So what does that look like clinically? So you can have hives on your body, itching, you can have wheezing or shortness of breath, you can have swelling of your eyes, trouble breathing, swelling of your lips or your tongue or your throat, and your blood pressure drops and you look very, very sick, and almost definitely you'll end up in an emergency room if you have a severe allergic reaction. That's what we mean when we talk about severe allergies. And if you had a severe allergic reaction, it's more of a debate about whether you can get another one. I would tend to think it depends on the situation, but generally speaking, we avoid it. So Another common question that I get is, well, I had COVID. I had a definitive COVID. It wasn't, I felt sick, but I even got a test and it was positive. I got over it. Do I need the shots if I've had COVID? So yes, this is generally advised. And why, what's the point? Don't you have antibodies from getting over the infection? Yes. But when people get a vaccine on top of having the infection, their protection goes up quite a bit. In fact, it goes up twofold. You're twice as likely of getting COVID again if you've had COVID and do not get the vaccine, compared to the people that did get the vaccine after they had the COVID. So it's extra protection. You can think of it as a booster. This is too many words. I recognize that, and I don't want you to get too bogged down in details on this slide. So is one shot better than the other? So first I'll say Pfizer and Moderna are both really, really good. They're both considered to be over 90% effective, especially for the earlier variants of COVID like Alpha. And they were even much more effective than that at preventing death. So over 90% effective at preventing someone from getting an infection, and even better than that at preventing death. That is fantastic. That is why we've been able to come out of the pandemic to some extent. Much, much more than the medicines that we give for COVID while people have COVID. This is really the difference. So is Pfizer or Moderna better? So both are probably, if you get the series of both, they're probably more effective than Johnson & Johnson. And in general, we tell our patients that the two-part vaccines are probably preferable if you have lupus and you really want that good protection. So how about Pfizer versus Moderna? We thought of them as being very, very equal, I would say, in the earlier parts of the pandemic. Is there an update on that stance? So there is actually something that has been released by Harvard where they studied over 200,000 patients, and this is kind of hot off the presses. And they looked at patients basically getting vaccine and saw over the next 24 to 36 weeks who got sick, how many people got sick with each one. And they compared Pfizer to Moderna, basically, which one's better. And the bottom line here was per 1,000 people with Moderna actually got about 1 infection less than Pfizer, which means it was just a tiny, tiny, tiny bit better. But those numbers are great. That means per 1,000 people, only 5 people are getting the infection at all, which is fabulous. For the newer variants, the mutated ones, like I'm sure you all have heard of Delta, and some of you might have heard of the Omicron variant, they compared that as well, and actually that favored Moderna even a little bit more than for the earlier variants. So the bottom line, the takeaway here is Moderna was a little bit better at preventing the infections than Pfizer, but how much? Very, very, very little difference between the two groups, and both are still fabulous, and we recommend whatever's available to you. So when do I get a booster is another question I think people who have been vaccinated are wondering, and I think the latest stance here is, first of all, what is a booster? We've kind of talked about it like several times here. I keep saying boost. So essentially, once you get that good antibody and immune response, you're asking, like, how do I maintain that response? And how do I make sure that I keep all those antibodies around so that if I'm exposed to COVID, I'll have that quick killing of the COVID virus and it goes away and it can't cause an infection. So that's a booster. That's what a booster does. So essentially, when can I receive this and who can receive this? In this one, there's really not that much information for kids. But if you're over 18, which the majority of you would be, if you've been fully vaccinated, you're now eligible for a booster. Even, it doesn't matter if you're immunocompromised or not. If you just have lupus and take no immunosuppression and just take Plaquenil or take nothing at all, you're still eligible to receive a booster. So when do you do it? So the bottom line here is the latest is 6 months after. If you've waited 6 months after your vaccine series, the first 2 or 3 shots that you've gotten, you can get another one. If it's Johnson & Johnson and you've gotten your 1 shot, you can give a booster 2 months later. But as I said, most people seem to get Pfizer and Moderna, so it tends to be wait 6 months, give another one. Can I boost with something other than what I've received? If I got Pfizer, do I have to get a Pfizer booster? No, none of that matters, actually, to the best of our information so far. You can get boosted with whatever's available to you. You know, if you happen to get Pfizer, getting the Moderna booster is okay, or you can stay with the same one. So what if, and these are kind of common things that I'll hear around basically reasons why I wouldn't want to get vaccinated. So what if I'm okay with the risk of COVID? really, my argument then isn't about you, actually, it's about everyone around you. So I would consider the closest people to you, your loved ones and people you interact with on a daily basis. By protecting yourself from the COVID vaccine, you're also decreasing your chance of spreading it to other people. And we're talking about in an enormous way. It's a huge gift that you give everyone else around you. There's also one other very important thing that you all may not be aware of, which is the more people that the COVID virus infects, the more chance that it mutates. Mutation happens when a large number of people have the virus, and it happens by random chance. And then the more people it infects, the greater the chance that'll happen and sooner. Whereas if you keep people from spreading the virus, you're actually preventing the mutation. You're preventing the next wave of something that could be worse and could kill people. So you're actually preventing society at large from dealing with COVID. You're helping us all get out of the pandemic faster, and you're preventing people down the line from getting sick and dying of COVID. So let's jump into frequently asked questions about vaccines in general. Some of these are COVID specific, and some of these are kind of about other things as well. And they are all very important questions that you hopefully should be thinking about if you have lupus. So one thing that's really common is, can I get the flu shot and COVID shot together because it's, we're headed into the fall seasons, they'll both be offered, and can I just knock them both out at once? Is there any reason why you can't? No, you're allowed to receive the 2 shots together at the same time on the same day. There's no evidence right now saying that your reaction will be worse. I can tell you personally, I got both on the same day. I couldn't really tell the difference. The same is true for COVID and other vaccines, COVID and let's say pneumonia, COVID and the tetanus shot. It doesn't matter. You are technically allowed to receive them on the same day. Some people will choose to say, I'd actually rather receive them on different days, and that's perfectly fine with me. I don't think you'll find many doctors have an issue with separating them either, but if you'd like to receive them together, that's perfectly reasonable from our standpoint. Can I have COVID if I'm still vaccinated, or any of these infections we're talking about that we give vaccines for? So your chances are definitely lower depending on which vaccine you get and what infection we're talking about. But yes, it is theoretically possible to have the infection even through the vaccine. Just like I hinted at with the shingles vaccine, if you get the infection, it's almost definitely that it's going to be less severe, which is why we're seeing people die of COVID less. Certainly get it less, but die of COVID less. It is extremely effective at preventing death, including even the Johnson & Johnson vaccine that is thought to be less effective at preventing the spread. So generally speaking, can you still get the infection? Yes. Is that a reason not to get vaccinated? Absolutely not. So why do some vaccines need to be repeated? And there's really 2 reasons, and I hinted at this already. So some of those memory cells that record basically the prior infection and that help make those antibodies are lost over time. They're not as good at doing their job, and some of them you literally lose. And sometimes you need a booster in order to remind your immune system, hey, remember this thing, so next time you see it, don't forget it. It's like if you have a bouncer at the door of a bar and you show them a picture of someone who's not supposed to get in there. Another thing is, and I mentioned this as well, some viruses mutate. This has happened to COVID. This happens with all the cold viruses that you get in winter. This happens with the flu shot. So new strains often aren't as protected. They're not protected as well by the old vaccine, which is why the vaccine is updated in the case of the flu shot. There might be a time when we have vaccines for COVID for the newer variants, although right now they're just recommending it for booster purposes. This is a really important question that you might get. So, isn't my immune system already overactive? Doesn't that mean that, in concept, it would be unsafe to give something that activates it more? Or at the same time, isn't it already overactive? So why shouldn't I be protected against infection because of that? So what I'll say is, first, yes, you have an autoimmune disease. Auto means self. What's happening there is your immune system targets living, healthy tissue in your body. That is not the same thing as saying that it's better at fighting infection. It's only overactive in the way that it's kind of targeting you. It doesn't target necessarily infections any better or worse than the average person. But of course, if you're on immunosuppressant, it's actually worse at doing that. So you absolutely should receive a vaccination. If you're immunosuppressed, and even if you're not, and you're due to get these vaccines, because lupus does not protect you from infection. No autoimmune disease protects you from infection by itself. Another common question that I'll get around, especially the COVID vaccine lately, is will the vaccine make my lupus flare? This is something that's been studied. They're still kind of collecting some data about this, but we do have a couple studies. One good one was from Johns Hopkins, and it was released a couple months ago with thousands of patients who had gotten the COVID vaccines and had autoimmune diseases of various kinds. Many of them had lupus. Excuse me. Many patients in the trial had the very typical vaccine side effects that I talked about: nausea, chills, body aches, etc. A few of them were thought by their rheumatologists to have mild flares of disease. Nobody, and this is the big takeaway, nobody in that study of thousands of people ended up in the hospital after a vaccine. Nobody died, which is really reassuring to say the vaccines will probably not make your lupus flare in any meaningful way. It might make it flare a little bit, but you know, the people that flared in the study were already people who were flaring within the 6 months before the injection, which means there's a good chance those people would have flared anyway. So generally speaking, will these vaccines make your lupus flare? Maybe a little bit, or maybe it won't, but it almost definitely won't make your disease worse. But should I get one if I'm in a flare? And this is something that maybe different rheumatologists will say different things. In general, I would say it's best to wait until the flare is mostly better before getting the vaccine. What's the logic in that? So is it safe? Well, you just said it doesn't make my flare potentially that much worse. I would say many side effects of the flu and COVID vaccines actually remind you of a flare, right? If you have active lupus, you might have fatigue, joint pains, chills, muscle aches, and those are some of the similar effects of the vaccine. So if you're having those effects, can we say that that's lupus, or can we say that it's the vaccine? It's almost better to be out of the flare so you know it's not basically just a vaccine side effect that you're having. Basically, it helps us make decisions a little bit better. And then if you're in a flare, just adding something else that can make you feel bad at that time may not be ideal. It may make you feel like you're in a worse flare. So generally, we wait. One of the final questions I have here, is it safe while I'm on immunosuppressive medication? So as I mentioned, there are types of vaccines that are perfectly safe to receive if you're taking even the most immunosuppression, the people on cyclophosphamide and high-dose prednisone for serious lupus. So yes, you can receive it and should receive it in that case. Why? Because if it's a killed vaccine, there is zero chance. It is not able to wake up and cause an infection in you. If it's fragments of the virus, it cannot cause the infection. As I mentioned, there's only one kind of vaccine that you should not receive if you're on significant immunosuppression, and that's a live vaccine, so that like intranasal flu shot. And there's a couple other ones, but none of the ones I had talked about are that kind. Another point is that there's actually, if you don't believe me, there's also a lot of data about this. People who were in the trials all had, not all, many patients had serious autoimmune disease. Many of them took serious immunosuppression. And guess what? None of them would get the infection from the vaccine, because it's just not really a possible thing as long as you get a killed vaccine. So are they safe? Yes. Bottom line, yes. How about, do they work as well? That's a really important question, and it's something that we're still working out to some extent. This is debated, and I would say that there's almost definitely some kind of a blunted response, a worse response, and a less effective response when you take the medicines methotrexate and especially rituximab. These two are probably the best at preventing antibodies in you. And that's one of the ways that they benefit you in lupus in concept, although a lot of patients with lupus don't actually take these two. But if you happen to be on these, you should really be aware there's a good chance it will not be as good of a response. And in terms of saying, well, what kind, is it a 50% response? Is it 25%? I think the exact numbers are still being worked out. And what I would do in that case is talk to your rheumatologist, because some rheumatologists will actually hold some of those medicines for a minute so that you can get those vaccines so you can still get an immune response to them. my philosophy in general is if you're on other immunosuppressants, it's less worked out, basically. So if you're the person who's on Celecept or azathioprine or Benlysta, my philosophy is some protection is better than none, and every rheumatologist will make a little bit different decision about how to hold that medicine or whether just to continue it right on through. That's a decision you should make with your rheumatologist. But you should be aware, yes, there's a chance the vaccines won't work quite as well if you happen to be on specifically rituximab or methotrexate, but also to another extent, just immunosuppression in general. That is not a reason not to get it, because if you get some protection, in my view, that's better than zero. So these are just some different resources that I've listed here for you if you'd like to do some of your own reading. So where I got a lot of information for this presentation was the cdc.gov, and if you look into vaccines, that is a really great resource. It has things that are understandable, written in layman's terms. So I encourage you all to check that out. You can see lupusil.gov as well, and certainly talk to your rheumatologist, because we're very happy to answer questions about all of that. So I think hopefully I didn't go over time. That is it for me. And if you all have questions, I'm happy to answer them. And of course, we will have time to, even if we don't get them answered right now, at the very end when we do our roundtable discussion.
Thank you so much. That was a really great presentation, and obviously really important and timely. I do want to point out lupusil.gov I don't believe exists. We're lupusil.org, but I can change that on the video permanently. One small error in the whole thing. I just didn't want anyone to write that down. But really wonderful presentation, and we do have some questions. Working at the Lupus Society, we get calls from people who say, I got the vaccine, Moderna or Pfizer, and I got really sick, and they think it's because of the lupus. So we always tell them that they have to talk to their doctor. They really need to speak to their doctor about what's going on, right? Because there are still studies going on about how the vaccine impacts lupus patients. And I'm not trying to suggest anyone shouldn't get the vaccine at all, because we all know that it is better. But we do get calls routinely from people who say that they're sick. What are the odds, do you think, based on the evidence so far, and we're like a year in with the vaccine, of the vaccine causing that flare?
I think that it's hard to comment on a specific percent of people who will have a flare with the vaccine, just because I don't think there's very high quality studies to this point to tell us what's the expected rate of either bad reactions to it or an actual, what we would call a lupus flare, where you might have some of the symptoms and some of the blood tests that show that lupus seems to be active. I think that you essentially do the right thing, which is if you're feeling unwell after it and you're a lupus patient, whether you're on immunosuppression or not, that is something where the tiebreaker can be talking to your doctor, going in to see your doctor, potentially even having some labs drawn to help us make a decision of, are you just having some lupus side effects? Or perhaps are you actually in a flare, excuse me, not lupus side effects, a vaccine side effects, or are you in a lupus flare? So while I can't give you an exact number, I think that what you mentioned is absolutely right, Mary, that you should talk to your doctor to get a sense of what's going on if you are feeling unwell after your vaccine, especially if it's lingering beyond a few days.
Okay, great. We did get a question from Terry, and she said on the what if I'm okay with the risk of COVID slide, a question, how does the COVID vax decrease others or my own chance of getting COVID tremendously, as noted, when Delta and the new variant are widely infecting both vaccinated and unvaccinated individuals? And I think you touched on this a little bit, but a good question to reiterate.
Yeah, so great question. Of course, as a virus mutates, it can potentially infect people who have received the others, especially if you receive the COVID vaccinations that are available to this point. They were mostly intended for the first variant. So perhaps they're a touch less effective at protecting against the newer variant. So what they're doing, part of why they're doing boosters is because you still get some protection. Again, I can't give you an exact number, but I can tell you that you are still decreasing your chance of death, whether it is Delta or Omicron or any of the variants, when you get vaccinated. So it's still very much encouraged. It does decrease your risk, and I would stick with the term tremendously. You know, in terms of actual percentage, I'm not able to give you that information necessarily, but you do definitely decrease your risk of receiving the infection, of dying from the infection, and of passing it on to others, even if you've been vaccinated against the earlier variant and there's not necessarily a vaccine that's intended for the later variants yet.
Right. I really like that you said that the purpose of vaccines isn't just to protect yourself, it's to protect the person, everyone that you come into contact with, right? Because we are a community of people who get sick. So, yeah, I think that's great. We also did an educational event in February, right when the vaccines were widely available, and we had someone from the Illinois Department of Public Health talk about, because people keep asking for lupus-specific information, and there really isn't any, right? Like there's more now after a year, but she just reiterated that before the vaccines were approved, and they were rushed through the FDA for emergency approval, 50,000 people participated in that. It's not like they took, you know, 25 people from down the street. Like 50,000 people were tested before that went wide. So they are very well tested vaccines, and they are very safe, right?
Absolutely, 100% agree.
So here's another question. What if I'm on Benlysta? Can I take the booster?
Yes, there's no reason why you wouldn't be able to do the booster, even if you're on the highest level of immunosuppression. I think when it comes to each drug in particular and the risk of the vaccine not working as well, you might get a slightly less great response compared to if you're not on that medicine. But I would actually emphasize it's important to get the vaccine if you're taking something like Benlysta, and to get the booster, because the more times you're exposed to the vaccine, the greater the immune response will be. So I would even say, you know, you should receive the booster if you're on Benlysta.
Okay. And then can you just review some of the anaphylactic shock symptoms, just so that people can kind of distinguish those from a flare?
Yeah, and I'll go back also to that slide, because I think it listed and showed some of them, and I think pictures are better than words. So really, if someone has a true anaphylactic reaction to anything, the symptoms that we look for are on the skin. You might see hives, which are kind of raised welts, which can be kind of splotchy looking. You might see itchy skin. You can even see a little bit of skin swelling. In the lungs, this is a really important thing, because this is one of the things that threatens people's lives. You might actually feel short of breath. You might be coughing, and you might be even wheezing so loud that someone else might be able to hear it without even listening to you with a stethoscope. One of the other important effects that you might not feel but you would see would be low blood pressure. If you did feel it, that could be like lightheadedness or passing out. You'd also, usually people in anaphylactic shock, they look very pale, they look very sickly. It is obvious that they are sick. And then swelling is another important effect. So if you're the person who has tongue swelling, throat swelling, or lip swelling, or swelling around your eyes, there's a very good chance you're having a pretty significant allergy to that. But what defines shock is that low blood pressure. And often that happens at the same time as the lung effects. And those are the things that would really, really worry us.
Okay. Great. One thing I was, first I thought I loved the videos, because, you know, I was raised on the Sesame Street generation. So those videos are really helpful. And we got comments about that as well. But one thing is, like with boosting your immune system with lupus, like I know echinacea is, you know, a homeopathic thing that is not recommended for lupus patients. So it sounds kind of confusing that you're not supposed to take echinacea, but you're supposed to boost the immune system with vaccines. Can you tell me maybe a little bit about the differences there?
So yeah, I think that in echinacea, or many supplements that you would, you know, think would be boosting the immune system, they perhaps have some effect on the immune system. It's difficult to comment exactly, because I don't think the studies on them are particularly well defined as to their exact effect. It's a more general sort of thing, whereas if you get a booster, you're giving a sort of a targeted immunity towards something. So boosting your immune system in general sounds nice in concept, but in terms of measurable effect and how much that decreases your risk of getting a particular infection is very difficult to quantify. Whereas if you do get a vaccine against a particular bad thing, the risk of getting that bad thing is considerably lower. So I would say the difference is it's specific and it's probably just way better studied.
Yes. Okay. All right, great. And then one last question. I know that some people get viruses and some people don't. Is there a genetic component to this? And is there any information on that? There's no way to test to see if you have natural immunity to a virus, right?
So no, usually with some people, as you mentioned, I completely agree. There are people who seem kind of extra at risk of getting a viral infection or any kind of infection. Actually, there are certain immunodeficiencies that can happen in certain people that we know about, and then there are ones that basically are probably just one person tends to get a little sicker than another person for some genetic reasons. There's not really a great test unless you're someone who has a true immunodeficiency, where let's say you've had numerous viruses or bacterial infections, or let's say fungal infections throughout your life. Then there are actually some different genetic tests that people can check to see if you have that. But if you have a natural immunity to say like towards something like COVID, there's really, to the best of my knowledge, nothing like that.
Yeah, so like if you have one parent who's prone to infections and another one who never gets sick, it doesn't mean that you're going to be one or the other. You really have to, so if you have a family member who's been exposed to COVID and didn't get COVID, doesn't mean that you won't get COVID, right? Like that's not how genetics work, right?
No, it's way more complicated than that. And the bottom line is there's not really some great way of checking that, and especially if you're the person who's prone to infections. I mean, listen to yourself. You've lived your life and you've seen if you've gotten infections or not, especially if you're prone to infections. That's another argument that you should really be vaccinated. But if you're not, then having that extra protection it's not a bad thing. It's a good thing.
All right, great. So that's the end of the Q&A. Thank you so much. That's wonderful. I know you're going to be back for the panel discussion. So if we didn't get to your question, we can take it up there. And we're going to head into our break. Thank you so much, Dr. Cherney. This was really a wonderful presentation.
Thank you so much.
And before we head to break, I do want to thank, we have one of our sponsors, Elise Griffith, who is with GSK, is here. And I'm going to invite Elise to say a few words. And I'm going to pass the presenter over to her. So thank you so much, Dr. Cherney. If you want to turn your camera off, and we're going to head into the break. Thank you so much.
Sure, thank you.
Let me go back here. Give me a second on that one. But hello, everyone. Such a wonderful talk before.
Yeah.
With the physician that just spoke, I picked up a few pearls again, and that's always a wonderful thing to be able to share or to learn. And I just want to thank you, Mary, for an opportunity again to support such a learning experience with the members of LSI and the greater community that of lupus warriors that are living with lupus. It's an honor to be here today. I would like to wish each of you a happy holidays and know that GSK will continue to support LSI and the broader community in the greater Chicago area to help continue to fight against lupus, knowing that it's so important for us all to be involved in the early diagnosis process, the research for lupus, and also making sure that lupus warriors are getting quality healthcare that is affordable, accessible, and also helps to close the gap on health disparities. And that's one of the things that we're going to be trying to support. We have our Us in Lupus website, usinlupus.com website. I encourage each of you to go to that website and learn as much as you can about living with lupus that we have there for you. Again, I say thank you, Mary. I am enjoying the symposium that you're putting on here, and I wish each of you again a happy holiday and look forward to working with you throughout the year.
Wonderful. Thanks so much, Elise, for all of your support. All right, everybody, we have a break.